Welcome to Empowered Health. This week we have an amazing lineup of specialists with information to help you take your health to the next level.
That's right. We are going to be hearing about the research Dr. Steve Passmore is doing on movement measurement, and we're going to learn about wisdom teeth from Dr. Bahi.
Right now, we have another amazing story of someone taking an integrated approach to their health.
The symptoms were feeling as if like somebody was pulling me down, like from inside. So I knew that's not normal, and there's an issue going on here.
Anna is describing her prolapsed bladder, which means her bladder is literally slipping out of place.
Sent me to the gynecologist and we went through the options. One choice was a full hysterectomy. There was also something that they could insert to hold everything up, but that's all it did. It just holds everything up.
Anna's gynecologist suggested she try physiotherapy before surgery. That's when she was put in touch with the Diane Clinic in Vancouver, which specializes in issues related to the pelvic floor.
So this is a female pelvis, and it fits inside me this way. So there's a pubic bone there and the hip bone's here, and your sacrum and your tailbone's, bone's very low. At the bottom of this is a muscle. There's a layer inside and a layer outside. And those two layers together form your pelvic floor. And if those things start to drop down or they prolapse, women come here to learn how to use their muscle to help hold things back in place.
The difficulty with this muscle is that it's out of sight and out of mind. So actually finding the muscle is a challenge. One of the tools the Diane Clinic uses to help patients get in touch with the muscle is biofeedback.
We use a specific type of biofeedback where there's little electrodes. One is placed on either side of the anus and one on your thigh, and it reads the electrical activity from the muscle. It doesn't give any electricity or give any kind of zap, so it reads the information from the muscle and graphs it.
Here, the biofeedback is placed on the arm. And as you can see, when the muscle tightens, the graph goes up and stays up as the muscle remains tight. When the muscle is relaxed, the graph drops down.
So part of my exercises were to count from 1 to 10 and holding the pelvic floor tight. And I could see on the camera that at 7 is where I start to lose the grip. And so I know at 7, I need to re-grip, basically, to get me to 10.
The biofeedback does not help strengthen the muscle itself, but does provide valuable insight into doing prescribed exercises. In Anna's case, Kegel, properly and effectively.
So it gives people information on what their muscle is doing when they can't actually see it, and they can look at the graph and learn what the feeling in their body is related to what they see on the graph, and they can learn how to control their muscle and how to strengthen it. It's diagnostic for us and educational for the client.
It's something that I'm going to have to continue doing, but at least now I know what I'm doing and how to do it.
Coming up on Empowered Health.
If you're shelling out big bucks for organic fruits and vegetables, you want to believe they're better for you.
You know, BJ, I don't know about you, but I usually try to buy organic food whenever possible. I know it costs a bit more, but I figure it's got to be better for us, right?
Randy Shore's been looking into it. Let's see what he's got to say about organic food. Randy?
If you're shelling out big bucks for organic fruits and vegetables, you want to believe they're better for you. And most of the organic food shoppers I talk to say just that. But researchers at Stanford University dropped a bomb on the movement recently when they released an analysis of 240 studies on the value of organics and found no nutritional difference between organic produce and conventionally grown foods. That's not to say there were no differences. This is one of those rare studies that had both sides of the debate declaring victory. Organics are grown without the use of synthetic fertilizers and pesticides. And the researchers did find that 38% of conventional produce contained measurable pesticide residue. Then again, so did 7% of the organics. None of the samples exceeded government-set safety limits. The researchers also reported that children who ate organic fruits and vegetables had fewer pesticide residues in their urine than children who ate conventional foods. Now, children eat proportionately more fruits and vegetables for their size than adults do, so parents tend to be keenly interested in these kinds of results. Organic produce does contain significantly more phosphorus than conventional produce, but there's little chance that you're deficient in phosphorus. Some individual studies have shown that organic fruits have more vitamin C than conventional. But if you're the kind of person who eats fruit of either kind, you're unlikely to be deficient in vitamin C either. Organic pork and organically raised chicken are less likely to be contaminated by antibiotic-resistant bacteria than conventional meats. These bacteria are destroyed by cooking, but doctors are concerned about the use of antibiotic feeds called growth promoters. There is evidence that drug-resistant germs are created that cannot be controlled with common antibiotics used in human medicine. What this study, and indeed every other study, fails to address is, does it really matter? Will eating organic have any measurable impact on my health and well-being? It's a question we may never be able to answer, because the kind of study required would require us to control the diet of a large number of people over decades. For some people, the fact that organic farming puts far fewer pesticides and chemicals into our soil is enough to justify the price premium. But I think a lot of people were really hoping that organic would make them healthier and live longer too. So far, science has no answer for that question. I'm Randy Shore for Empowered Health.
Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive care from a qualified chiropractic doctor for appropriate diagnosis and treatment. That's also why BC's chiropractic doctors fund research and education. Today, I want to introduce you to Dr. Stephen Passmore, who's conducting research on measurement, movement, and chiropractic care.
I do some work trying to look at specific populations that can possibly benefit from chiropractic care. Now, before we can jump into a large randomized control trial or a large clinical intervention study, we need to establish some outcome measures for that specific population. And so right now, we're working on lumbar spinal stenosis, specifically degenerative lumbar spinal stenosis, and developing some quantitative outcome measures to try to evaluate that population.
This type of information is multifaceted, but more importantly, it will help a spine surgeon, neurologist, chiropractic doctor, and many other health professionals.
That's one of the real reasons why it's a particularly interesting pathology to study, because spine surgeons in general have a very long wait list before someone is able to get in to see them. And there is a point in time where someone with degenerative lumbar spinal stenosis does become a surgical emergency, and that's when you start to see bowel or bladder dysfunction as a result of the actual progression of the disease. But there's a big window of time that happens before that where people might just be sitting on a waiting list, but they could potentially benefit from conservative intervention like chiropractic.
By establishing where patients can benefit with chiropractic care, we continue to create positive health changes. For a patient awaiting surgery, it can reduce pain and, more importantly, help them maintain their lifestyle. It could also help reduce the burden on surgeons' waiting lists. It's all a part of a chiropractor's role in your healthcare.
Our goal is to try to bring more science to the understanding of the practice of chiropractic in terms of the clinical populations that we can see who may benefit from care, and in terms of the referral patterns, and in terms of just trying to explain what we deliver as chiropractors. If we can use more empirical scientific evidence to describe that, then we have a very strong leg to stand on as a profession.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow and better healthcare outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.
Today we're going to show you how to perform and progress the push-up. All right, Simona, let's go ahead and do the push-up to hit the chest and the arms. I'm gonna get you to start with your hands nice and wide so you hit the pecs. Your feet should be together and your glutes should be contracted while you draw on your core. I'm gonna place the stick on your back to represent a neutral spine. Okay. Go ahead and lower yourself nice and slow and exhale on the way up. Now, depending on your body weight and your fitness level, you may want to start with your hands elevated on a bench and work your way down to the floor. To increase the intensity, you can go on one leg or elevate both feet on a stool or a bench. Good job. All right, try this exercise out and we'll see you next episode.
After the break.
When you come in to see your professional, you should consider that it is going to take time to determine what your style is going to be, and that you'll need to take time to talk about lenses and lens technologies.
Welcome back to Empowered Health. Most people end up getting their wisdom teeth taken out, but do we really have to get that done?
Dr. Bahi is here to talk wisdom teeth and take us through what happens and why it's necessary to have them removed. Dr. Bahi?
Today we're talking about wisdom teeth. By the age of 18, the average adult has 32 teeth, 16 on the top and 16 on the bottom. Each tooth has a specific name and function. The teeth in the front are the incisors, canines, and bicuspid teeth. They're ideal for grasping and biting food into smaller pieces. The back teeth, the molars, are used to grind food for swallowing. The average mouth is made to hold only 28 teeth. It can be painful when 32 teeth try to fit in a mouth that holds only 28 teeth. These 4 other teeth are your third molars, also known as your wisdom teeth. You might be asking yourself, why would I have my wisdom teeth removed? Wisdom teeth are the last teeth to erupt within the mouth. When they align properly and the gum tissue is healthy, wisdom teeth do not need to be removed. Unfortunately, this does not generally happen, and that's when we need to take them out. If we don't, they can grow in sideways, partially emerge from the gum, and even remain trapped beneath the gum and bone. These poorly positioned, impacted teeth can cause many problems. When they are partially erupted, the opening around the teeth allows bacteria to grow and will eventually cause an infection. The result is usually swelling, stiffness, pain, and illness. The most serious problem occurs when tumors or cysts form around these impacted wisdom teeth, resulting in the destruction of jawbone and healthy teeth. Removal of the offending teeth usually resolves these problems. Early removal is recommended to avoid future problems and to decrease the surgical risk involved with the procedure. So let's take a look at the process. Like all good dental work, it starts with an oral examination. We x-ray your mouth. Now here's the key. You want to make sure an oral and maxillofacial surgeon evaluates the position of your wisdom teeth and predicts if there are present or may be future problems. Studies have shown that early evaluation and treatment result in superior outcomes for the patient. Patients are generally first evaluated in their mid-teenage years. If it's determined that your wisdom teeth don't need to be removed, it's important that over the years you have an ongoing discussion with your dentist about the state and health of your wisdom teeth. All outpatient surgeries are performed under appropriate anesthesia to maximize patient comfort. I want to point out that oral and maxillofacial surgeons have the training, license, and certification to provide all forms of anesthesia, including general anesthesia. I urge you to look for facilities that are certified by the College of Dental Surgeons to provide all of the various forms of anesthesia, including general anesthesia.
I'm an artist and I'm drawn to something that's quite different and quite stylish.
When you come in to see your professional, you should consider that it is going to take time, if you're seeing just specifically the optician, to take time to determine what your style is going to be, what you're looking for in your new eyewear, and that you'll need to take time, more importantly, to talk about lenses and lens technologies, because that's really where you're going to notice the difference.
There's a lot to consider when you're choosing new frames. That's why it's important to make sure you're working with a licensed optician.
So when we're fitting lenses for people, we need to sit down and have a very detailed conversation with them about their lifestyle and what they do on a day-to-day activities with their eyes.
Here are just a few things that factor into choosing new frames that will work best for you. Your prescription, type of lens technology, progressive, standard, your activity level. Do you spend most of your time outdoors, indoors, on computers, driving, or playing sports?
What we want to look for is both cosmetic and technical fitting. So you can have a frame that a client really loves the look of it, but it technically doesn't fit them well, or it won't work well with their eyeglass prescriptions. Depending on how far away the frame sits from your eyes, can change the prescription slightly, with a higher prescription more specifically. The angle, we call it a pantoscopic angle, the angle in which the frame lies on your face makes a big difference to how a client will see through those lenses, and the actual wrap or the curvature of the frame will also change the vision of the client.
I have progressive lenses. I do visual arts. Like I work at this, basically that distance to an easel, right? So I need to be able to see that distance and see it clearly, so it helps me to see my artwork better.
People do have different timelines when they're adapting to their new eyeglasses. We'll find that some clients adapt almost instantly, and other clients can take a few weeks to adapt completely to the new eyewear, even a single vision versus a progressive lens. The adaptation is something that you need to work back and forth with your optician on a personal basis.
When I go from a computer to reading to leaving a room or walking down a flight of stairs, I don't feel that transitional aspect to the glasses that I did before. I love these glasses.
Coming up on Empowered Health.
So parlor risotto with beets.
Barley risotto with beets. Yeah, it's comfort food. Great winter dish.
This cooking and nutrition portion brought to you by Save On Foods.
I'm in the kitchen with chef and holistic nutritionist Andrea Potter from Rooted Nutrition, and she's going to teach us how to make beet and barley risotto. Andrea, welcome to the show.
Yeah, thanks for having me.
So parlor risotto with beets.
Barley risotto with beets. Risotto means rice in Italian.
Right.
And I had a lot of conflict in coming up with an idea that was risotto but wasn't rice. But first we're going to make I call it a soup sauce.
Okay.
And what the soup sauce is going to do is flavor and color our risotto at the end. I roasted some beets here, just in a container with about that much water and a little bit of vinegar, just until they're fork tender.
Okay.
And I put a little bit of thyme in with them to flavor them while they were roasting.
Yeah.
And the skins should just slide off.
Okay, perfect.
So it saves having to peel them in the beginning.
Right.
So put your beet in here, cover it with a couple cups of water, just enough to make it go.
Right.
In the blender, and then put a little bit of thyme.
Okay.
Strip the leaves off, put the thyme straight in. So just blend it up till it's smooth.
Okay. Perfect. Okay.
Okay, so I'm just going to save this for later to color the risotto at the end.
Okay.
So on medium heat, put a little bit of olive oil.
Okay.
Like enough to coat the grains, so a few tablespoons. Very gently heat that. We're actually going to use the onion first.
Okay. All of it?
Yeah.
Okay.
So once this starts to sizzle a little bit, then we add the grains. So this is pearled barley that we're adding.
Okay.
It has the outer husk removed.
So no water goes in at this stage?
Right.
Okay.
So the risotto is covered in the fat and the onions are flavoring it. And I just let it sit and sizzle for a minute until it almost starts to toast the barley.
So add the wine now?
Yeah.
All of it?
Yeah.
And how much do we have here?
I got about half a cup there.
Okay.
And if you have a bottle of wine open, great, add a couple splashes.
Right.
If you don't, you could add grape juice.
Okay, yes.
So that's called deglazing. And then you let the alcohol cook off.
Okay.
And the wine should cook down so you can see the grains again.
Okay. Which is
Until
kind
it's
of beginning to happen now?
Yeah.
Yeah.
It should be au sec. Au sec means almost dry.
Okay.
So you actually want to cook it until you don't see any more liquid.
Okay.
I think it's ready now. So grab your ladle with the warm liquid. This is vegetable stock.
Right.
And you put one ladle at a time.
Okay.
And then let it get au sec.
Au sec. Okay.
And then put another one in. Okay, we're almost au sec.
Okay. And then another ladle of
Add
stock?
another ladle. Yeah.
Okay. Now?
Yeah. So this will take around 20 minutes. And it's something that you can do while you just prepare your side salad.
Right.
Or get the lunches ready for tomorrow or whatever. Just something that you need to kind of keep your eye on.
Right.
And then I tasted a couple of grains. Just pinch it between your teeth.
Right.
When it's still a little bit al dente,
Right.
but you can see it starting to get a creamy consistency.
Yes.
Then you can add all of the soup sauce to it.
Okay. So now is the time?
Yeah.
Oh, look at the color.
Nice.
Wow.
So now I'm just going to stir, make sure nothing's sticking,
Right.
and wait for this to become au sec once again.
Okay, okay.
And at that point, we can plate it up, put a little bit of parm if you wanted to add parm, and then garnish.
Okay. Well, let's wait for another round of O-secking.
Sure.
Okay. Andrea, this looks so good. Shall we try it?
Let's do it.
Okay, I can't wait. Here you go.
Thank you.
Oh, the barley tastes so great. And even everything's come together so nicely. It's so
Nice.
creamy.
Yeah, it's comfort food. Great winter dish.
Perfect. Well, you can find out more about this recipe in today's Vancouver Sun or go online to vancouversun.com/empoweredhealth. When I think of beets, I think of pickled or canned beets. Now, though, it seems fresh beets are also getting quite popular. And I've got registered dietitian Melissa LeBlanc with me, who knows a few things about using fresh beets. Melissa, welcome to the show.
Thanks for having me, VJ.
So, would you agree that fresh beets are getting more popular now?
I think so. You can find fresh beets in the produce section of most grocery stores. Many restaurants are featuring beets on their menus, and even baking recipes call for beets.
So, besides the exceptional color, what makes beets so great?
Well, when it comes to vitamins and minerals, beets are a powerhouse, but their rich color is also an indication that they're quite rich in antioxidants.
And what's the best way to use fresh beets?
If you're using the root, you can steam them, bake them, or roast them in the oven. If you want to use them raw, simply grate them and then add them to a salad, a soup, or even a dish like risotto.
Yeah, and they enhance the color of the dish so much and they make it so much more appealing.
They do. And my favorite part about beets is that you can also use the greens.
The top part?
That's right. They're completely edible and delicious.
So don't throw them away then.
No. So
Okay.
again, you can enjoy them raw by adding them to a salad or simply stir-frying them.
Well, Melissa, thanks for being on the show and thanks for another unbeatable segment.
You're welcome, VJ.
We'll see you again.
Well, that's all we've got for you this week on Empowered Health. You know, VJ, I didn't realize there were so many things to think about when choosing a new pair of glasses.
Absolutely, and I found some of Randy's findings on organics to be food for thought.
Tune in same time next week for more stories and information that will give you more options to empower your health.
We'll see you next week.
Bye for now.